Hello there, everyone. We are going to be talking about self-care for the caregiver. My expert on that is Caleb Harper, LPCC, NCC, and he is a mental health counselor. I reached out to Mr. Harper because I actually took a class myself about clinicians' roles in helping manage caregiver stress, and I was reminded of the changes that prolonged stress that comes with caregiving can have on our bodies, and really wanted to talk about the ways that we can recognize stress in caregivers. I very much identified with what I heard from many of you on the support group, just saying that you felt overwhelmed and felt like there was no time or resources for good self-care. And I just knew I had to reach out to Mr. Harper for some of his time, and he so kindly obliged. So without further ado, Mr. Harper, what have you got for us tonight?
All right, Ms. Gina, thank you so much for having me. This is a true honor. I appreciate it. So I wanted to start out with, you were talking about stress, feeling overwhelmed, how that looks in a person, especially caregivers, because caregivers have such an important role to take that it is important that they do recognize changes that are going on, not only mentally, but physically. So when we talk about being stressed and overwhelmed, that can look like anxiety, becoming frustrated and angry a lot, taking out your emotions on the person you're caring for or people around you, not taking care of yourself physically, mentally. And mental health can also play a role in physical health. If you find yourself feeling more tired than usual, not eating as much as you used to, or eating too much, sleeping all the time, or lacking sleep. These are all things that you need to be looking out for in yourself. And maybe if other people point them out to you, it's important to take note of that as well. So I wanted to start with that.
Yeah. Yeah. And I think it's interesting to see that everyone's stress is a little different. When you started with saying that, oh, you're eating less, I thought, oh, I don't do that. I eat more. So
Mhm.
it varies.
It does vary. I noticed that when I become stressed, I want to sleep a lot more.
Mm,
And when I notice that, oh, you're sleeping 8, 10 something hours, okay, it's time to do something a little different.
yeah.
Self-care, it is what it is. It's in the title. It is caring for yourself. Um, and yes, eating that cheap chocolate piece of cake, taking the bath with those bath bombs and Epsom salts, those are great, great forms of self-care. They really are. But when we truly talk about self-care, the thing that differentiates that between other forms of care is that self-care is directive. It has a goal, and the goal of that is to recharge and rejuvenate you. It has to be something specific that makes you feel great and alive. Meaningful is what it is. So while you're enjoying, bath bombs and face masks, or just cozying up with like a really good book, which is also really good too, other forms of self-care can include taking mindfulness walks, turning your devices off, walking around your neighborhood, not living in the past or the future, but staying in that moment, observing what you see around you. Yeah, people don't think about that, but that's one of the things our professor had us do is turn your devices off, walk around the campus, tell me things that you see that you have not ever seen before. And I was surprised by, what? I've never seen that building there. That staircase is actually pretty cool.
Yeah.
Things that make, yeah. Other forms of self-care, I know this is not going to be as popular as one, but it really is getting down and taking care of yourself. Pulling out those financial books and taking care of bills, priorities, things that need to be taken care of. I know that's not the most fun, but all right, this bill's got to be paid. I've got these doctor's appointments on this day. Let me get this all scheduled. And I find that I'm the type, I love having written schedules in front of me. Like, this needs to be done at the grocery store. I have to pay this bill on this day. And something that is so gratifying about just checking off each of those things once it's done. That's another form of self-care. Um, Another one, I had a supervisor when I was working on getting my licensure. He was asking me, what am I doing for my self-care? And I'm like, well, here's what I do. I watch these movies or something that, good, feel good. That's not enough. Okay, what do you mean? It's like, is it rejuvenating you? Do you feel alive again? Well, now that you're asking me, I guess not. So that got me into the hobbies. People will pick up like instruments or uh, developing actually new groups online. I have a patient of mine right now that is working to start an advocacy group for parents dealing with custody issues and things in the court system. And she is very adamant and determined to get this started. Um, Here recently, I've picked up and started picking up and learning a new language, something that challenges your mind and stimulates you.
Mhm.
So that's what you got to find with self care is something that you enjoy, something that's stimulating, and something that's directive.
Yeah, I like that. Yeah, I'm probably definitely guilty of thinking, oh, I'm exhausted, I'm wore out. It's okay to just spend several hours on Facebook or, like you said, watching movies. And you're right, it's probably not truly self-care because then I just kind of feel like lazy as opposed
Yeah.
to um I really enjoy yoga. I don't do it like I should. Meditation. Yeah, I grew up in
Mm,
the church, so prayer was really important, and meditation for many is a different form of just like quiet time and reflection. And
oh,
um,
yes.
I'm not good at just sitting with my thoughts, but the guided meditations, there's apps for free.
Hmm.
Have just 5-10 minute meditations on them. Imagining your beach and um, different things like that. There are a whole multitude of things that can cause caregiver stress other than just the caregiving itself, as far as it being financially taxing and emotionally taxing, physically taxing.
Oh, yeah.
Um, and so that's going to be things such as sleep deprivation. You're not getting a good night's sleep at night. Maybe mom has sundowners and she's getting up all times of the night, yelling out, looking at burnout, caregiver guilt, the financial stress, the fear of the future. Like, what if
Hmm.
this happens? Well, what if this happens? Well, what if this doesn't work out? That can go on forever. And just being overwhelmed by the amount of tasks needed and feeling like a lack of choice, especially when you're the only child or the only caregiver that's doing it alone.
Right.
It is superimposed on the underlying stress of doing it alone that you feel like you have to do it alone. And I think that's something I learned from my therapy was thinking about what you can control versus what you can't control. And that was in this class that talked about how to be a good support system for caregivers was having them make a list of things that need to be done. So personal tasks as far as have you gone to the dentist this year? Have you paid your bills for the month? Does your car need an oil change? Like very tangible things that you can get
Yes.
done. So personal tasks, household chores, and then maybe what are some things that you can delegate to someone else. So Thanksgiving was just coming up. If you were supposed to bring 3 courses to your, well, ideally family Thanksgiving dinner, that didn't really happen for a lot of us this year. Um,
True.
be okay with telling your cousin Karen or your brother John, being like, hey, you know what? I've got so much. I can't do this year. Is this something you can take off my plate? That's something you can do. Um, and just to be comfortable making a list of things that you're worried about as far as financial issues, your own health.
Mhm.
And it talked about emergency situations. So we did this when I was caregiving for my mom, and we had a red folder that had all of her medical records in it. It had all of her medications in it. It had her doctor's names. And just so if something happened, that we weren't running around the house, we weren't going through all the lock boxes. Like we knew that red folder was the go-to.
Yes.
Um, and even now, my brother and I, who are younger, we call it our lightning strike document. We have a Google Doc that's shared by both of us. So that just that if anything happens, that we know that that much of it is taken care of. So
That's great. And it's great, having that digital, but also having it tangible. I think something you can hold on to so it's not just in your mind, it's right here.
mm-hmm. But yes, having it printed, 2 copies in a location, like in the table by the door or something. Because that, someone has a fall or someone has a stroke, and that way because like you said earlier, you kind of sit and worry as a caregiver. You sometimes think about, oh, what could go wrong? You're thinking about the past, you're thinking about the future. And so that's one way to maybe reduce some risk on the future, is knowing that that is in place.
And that's why I said self-care sometimes isn't always that glitz and glam. It really is getting down and doing, the hard work that needs to be done. And I like that red folder, red folder, important.
Yeah.
It's right here.
Yeah. And it's a responsibility. It's keeping it updated, and things are always changing.
It gives you a sense of ease of mind too, knowing we have these plans in place.
Yeah, absolutely. So, one thing I hear a lot from patients, families, is that it's really hard on them to see those changes in their loved one, that come with dementia, the confusion. A part of a lot of it can also be aggression with that disorientation. So, what are maybe, every situation is different, every person's different, but do you have just kind of some general guidelines or support for caregivers that feel intimidated and overwhelmed by their loved one?
Yes. Okay. First of all, admitting to that, I am feeling intimidated. I am feeling overwhelmed. Huge step. That's wonderful. Please admit that when you're feeling overwhelmed, talk to someone about it. It doesn't even have to be a therapist, a trusted family member, a friend, a clergy member. Reach out and make connections, because that's one of the things with caregiving. You are pouring so much of yourself into someone that you are forgetting to take care of yourself. And it really is a thankless job, especially dealing with dementia, Alzheimer's. Uh, it can be scary and overwhelming. So, building a strong support system is a key first step in what I think keeping your sanity, keeping yourself grounded and okay, and
Yeah.
providing the best care to your charge as well.
Yeah, that's a tough conversation. I feel like one effective way that I've had with the family members that um, on that, progressing down that road, is saying, okay, if something happens to you, as far as them feeling that caregiver guilt of, I have to be there for mom, I have to be there all the time, I'm the only one, I've got to do everything. Okay, like you said, first step is admitting you're exhausted, and then after that, I feel like we have to challenge ourselves as caregivers to, because if you're the type of person that's being a caregiver, you're naturally a helpful person,
Mhm.
and you want to fill those roles for somebody. But we all have our limits, we all have our limitations, 24 hours in a day. So, but trying to get to think of, okay, if I'm chronically stressed, if I, some of the people caring for my patients are themselves in their 60s or 70s caring for their parents, and I say, okay, what if you have a fall? What if you're not sleeping well? What if you have high blood pressure and have a stroke? These things that happen.
Yes,
So,
they're,
yeah.
they're very real things. And I'm glad you mentioned that too. I was getting to it, the whole guilt. This is a family member. I'm a caring type. I'm supposed to be there. Yes, I mean, that's great if you're a caring type. The world needs more people like that. But also, it's okay to step back when you need to, because I always use, this is kind of a dark one. I hope it's okay to use this. It's an analogy I use with my patients during group or individual sessions. They're trying to recover from addictions and other life issues. And I find that a lot of times when they get into a role of, being sober, or, you have a caregiver taking care of someone and you're overwhelmed, I'm like, think of it this way. The airplane is going down, okay? And the oxygen mask comes down. Is it going to tell you to put it on the other person first or yourself? And why is that? You can't take care of yourself if you're not able to take care of someone else. Or you're not able to take care of someone else if you're not taking care of yourself first. I got that backwards.
No, that's the exact perfect analogy. I like to say you can't pour from an empty cup.
Mm-hmm.
You can't give to other people if you don't have any reserve yourself. And I think just telling people that it's not being selfish, it's not being inconsiderate to try and take care of yourself.
Exactly. I like that pouring from an empty cup. Yeah, it's just stepping back when you need to. There's nothing selfish about that at all. We're humans. Like you said earlier, we have limits to what we can do.
Hmm. Yeah. If even if you have all of the mental and emotional reserve in the world, there's only 24 hours in a day.
Hmm.
So even very tangible limitations like that can really hold us back from what we'd like.
Exactly.
Do you have any advice for people that have trouble asking for help or do not like to ask for help?
Oh, okay. So I can relate to this one. I used to be that same type of person, give, 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 do, 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 until, help, I'm drowning. I was that person before. Then I went to college and kind of got some of that, but then finally I was in grad school, that was all about our program is you ask for help, you talk about what you're going through. Um, my best single bit of advice for that is find your comfort level. Start out doing something small. If it's asking for, hey, can I have 20 minutes to myself? I just need to rest, take a nap, go out for a walk, do something productive. Start with that. Keep doing that over time. And then eventually kind of challenge yourself. That's the main thing right here is challenging your comfort levels, what you know, and expanding that. Try something bigger. Hey, I'm going to take a week off. I need so and so to take care of my person. This is all the plans, everything I've got in place. I'm taking that week off. But really, it takes a lot of work and it's not something that comes overnight, especially I get it. I was there. You don't want to ask for help, feel like you're inconveniencing people. But again, this is self care. It's your safety, your health, your sanity. So practice at it.
Yeah. And I think, again, kind of like the same people that are caregivers are the helpers, and they're those people that want to help. So they should also keep in mind as far as how much they want to be a help to other people, even if their brother or sister is not helping with the caregiving, taking care of mom and taking her to her appointments and taking care of her medicine and all these things. Even if the people that you think should be there for you aren't there for you, I promise there is someone in your community, in your church, there's a support group through the hospital, there's an Alzheimer's Association, there is somebody, whether they are local or online, that wants to help you in one way or another. Um, so yeah,
Yes.
challenging yourself in that way, even if it's not, you can't ask your brother to take mom to her appointment. Maybe there's an adult daycare center that has a transport in town, or someone from church can bring a meal on Sunday nights or something. So you may have to get creative, but that's when, again, like you said earlier, you reach out to that support system, and even if they can't help you do the thing you need done, they might know somebody
In,
that can.
in networking, exactly.
Yeah.
You believe it or not, I cannot tell you how many times in my own practice I have run into several people that come in that are actually doing exactly, it may not be Alzheimer's, but it's different things, caregiving for someone that's older, someone that has other disabilities, whatnot. And they find themselves completely being overwhelmed. And so that's one of the things that we turn the counseling sessions to is what resources are available. We have case managers in our facility. Um, Finding those local church organizations, hospitals, many places for support. And also, I mean, um, this COVID, but well, yeah, one thing about it is it really has turned us more towards an online society. And I think that we're able to find more resources than ever what we were to before.
Yeah, just like these videos. That's the whole reason why we got
Exactly.
started, was because, in our facilities, I thrive and love getting to educate the caregivers on how, once this patient goes home, ways that you can continue this type of therapy at home. And
Mhm.
with COVID, caregivers couldn't come in anymore. You couldn't come visit your loved one. So I thought, we've got to make this available to everybody. So that's how this got started.
It's great.
Yeah.
So there's some positive that's come from this.
Yeah. Yeah. Humans are very good at making the best out of tough situations. Here in America, rugged individualism is kind of our identity, and we just want to tough it up and fall on our sword, and we're better people for taking care of it on our own. And
We're constantly go, go, go. And sometimes it's okay to sit back. It's okay to watch, that trash TV show or one of those favorite movies you like. That's okay too. Uh, just keep in mind, when you are doing self-care, make it something that's really going to spark and renew you. And if you're making out those lists like we were talking about earlier, if you start finding yourself getting overwhelmed and, oh gosh, oh this, and this, step back, take a breather, okay?
mhm.
So self-preservation.
Yeah, yeah, because if you can't be there for your loved one and you're the caregiver, who's going to be there? They need you, and they need all of you. So it's okay to share. Let me phrase that a little differently. They need all of you, but they need like a full you, if that makes
A
sense.
well-rested, a well-adjusted you.
Yeah, yeah. Look at you, mental counselor. Like you do this for a living. Do you feel like there is a good crisis resource for someone that's feeling an acute change in their mental health, a panic, like a phone number or a website that they can use for assistance?
Okay, the National Mental Health Hotline is a great resource, and you can easily access that via Google. There's also a lot of great online resources. I know that you can get on your app since we are very connected today. Speak with mental health professionals via text message or calling. You go to the National Mental Health Association crisis line. Also, on the American Counseling Association website, they provide great resources and links to emergency services. And of course, if you are in an emergency situation, there is always 911 or your local paramedics, police, things like that.
Mhm. Yeah. If someone was looking to get a referral if they were
Mhm.
wanting to see someone like you or a therapist, how does someone go about doing that? Do you have to see a doctor first?
Oh, definitely no, not at all. What you can do with that is search for mental health therapists in your area, depending on where you live. Um, and for that, you do not need a doctor's referral, anything for mental health services. You can just call, schedule an appointment, and everyone can benefit from counseling. That's one thing that they taught us in our program is that anyone, it doesn't even matter if it's, hey, I just lost my job a few months ago. Yes, you're absolutely come in to see a counselor. Or I'm just feeling stressed and overwhelmed. There's a lot of change going on in my life. Absolutely call and find a counselor near you. And even if they're not nearby, see if they have mental health services via telehealth,
Mhm.
what insurances they take. And also another important thing too, when you find a counselor, read up about them, find out, what type of work they do, what kind of theory they practice from, just get a general idea of what they are like. And if you guys don't mesh, that's okay. Not everyone's going to get along.
Yeah, I think a few of my friends that have gone to therapy, and I have gone to therapy myself twice, two different rounds. But I think some people maybe get discouraged from going to therapy because they don't click with that first therapist that they have.
Right.
That it takes, like you said, meeting the right person, especially the school of thought and kind of the practice they follow. You want to get something that works for you.
Exactly. And with me in my line of work, I work in substance abuse. So if you're coming in with anxiety, more than likely, we're not going to be the best match. I work with opiate use disorders predominantly. So definitely Google, find out about the therapist beforehand. And when you say the term therapist, that is a broad category. Therapists include psychiatrists, clinical psychologists, social workers, licensed professional counselors, which is what I am, psych nurse practitioners. Find out, some like psychiatrists and nurse practitioners, they'll be the ones that prescribe the medications. Social workers and counselors are more of the talk therapy. So find what you're needing.
Yeah. So I know there's a lot of stigma around therapy and feeling like if you go see a therapist that you're broken, right,
Right,
therapist
right.
or someone that needs help. How do you care to talk a little bit about that?
Yeah, not at all. That is a great topic, actually. Thank goodness we're not in, I guess, the 50s, 60s anymore back then. Yeah, throw them in the bin, they're gone.
Right.
Uh, Fortunately, therapy has come a long way since then. And the stigma, it's still there. If I go see a therapist, I'm that, like we were saying, that crazy one, that broken one. Truthfully, nowadays, I'd be hard pressed to find someone that doesn't see a therapist or hasn't seen one in the past. I know that when I was in high school, I saw a therapist. That was a scary thing because, what's going on? Why am I talking to the stranger? What happens when the door closes?
Yeah.
I saw a therapist when I was in college. Even going through my graduate program, we were taught to seek out therapy for ourselves because, as counselors, therapists, we are dealing with a lot of things, the secondhand traumas from other people. It's important for us to keep our mental health and balance in check. So the important thing with that is therapy is for everyone. It's not just for crazies or someone that's completely broken. It's for everyone. We go to the doctor when we have a scratch, an infection, a cough. Isn't it more common to go to the therapist when I'm feeling sad, I'm feeling anxious?
Mhm.
So healthy mind, healthy body, healthy spirit, just all around well-being.
I love that. That's perfect. Well, Mr. Harper, thank you so much for your time tonight. I know this is going to help a lot of people that are using Dementia Care Source. So thank you so much for all your advice and wisdom, and we'll be seeing you again soon.
Thank you.